Hello everyone. In this video, we are basically going to focus on how antimicrobial resistance as a phenomena becomes very difficult in terms of treating infections. We will try and understand this with an example in mind, especially in the Indian scenario. We will also be looking at in the next week about the impact that antimicrobial resistance has in terms of different infections in India. But currently, we are going to take only one example into consideration in order to understand this characteristic in more detail. So let us begin with understanding the prevalence of AMR. It is really unfortunate that India as a country has been referred to as the antimicrobial resistance capital of the world, which clearly indicates that the rate of infections caused by antimicrobial resistant strains is on a super rise in our country. The prevalence rate of such infections is really very, very high. And this indeed makes the entire scenario very, very scary. Also, at the same time, there has been emergence of newer multi-drug resistance MDR strains, which means that, time and again, we are seeing that more and more microorganisms are gaining resistance to multiple drugs, and it is becoming very difficult to treat the infections that are being caused by them. It's estimated that around 7 lakh people lose their lives due to infections which are antimicrobial resistance based infections every year. And there is also this assumption that 10 million people will lose their lives due to AMR by 2050. That's a phenomenally huge number. And if you look at this number, this is going to be responsible for killing more people than what cancer or maybe road accidents combined together will be responsible for. That tells you how grave the entire scenario of AMR is. And we, being the AMR capital of the world, it puts us in a completely different limelight and responsibility now to understand how we can curb antimicrobial resistance, how we can stop its spread further, and make it possible to overcome this huge issue that we have as a challenge in front of us. Today, the example that we are going to deal with is of a bacterial infection, which is called as tuberculosis. I have purposefully picked up this example for a basic reason that the occurrence rate of tuberculosis in India is very, very high. TB is a bacterial infection which is caused by a bacteria called Mycobacterium tuberculosis, and it's an infection which is transmitted from one individual to the other through air. So it's an airborne infection. So if a TB infected individual coughs in front of you and you are in the same room, you have a chance of contracting tuberculosis. TB is an infection which usually affects the lungs, but it can eventually spread to other parts of the body, including kidney, spinal cord, brain, and other vital organs. TB is a treatable and a curable infection. We have medications to treat tuberculosis, but if you do not start the treatment on time, if you let tuberculosis condition worsen, then people can even lose their lives. So starting the treatment on time, diagnosing tuberculosis on time is of utmost importance. But unfortunately, with time, we have seen that Mycobacterium tuberculosis, which is the bacteria which causes tuberculosis, has started gaining resistance against the antibiotics which was used since a very long period of time to treat TB. And unfortunately, the rate with which drug-resistant tuberculosis is spreading in our country is really worrisome. There are several drugs which we used to normally use for tuberculosis which are turning out to be completely useless because Mycobacterium is getting resistant to these drugs, which means that these drugs can no longer act on the bacteria and curb or stop the infection. Let me tell you that amongst drug-resistant tuberculosis, further we have three types. We have something called as multi-drug resistant TB, which is also called as MDR TB. This is a condition wherein you will see that the bacteria is resistant to two antibiotics, isoniazid and rifampin, which was used for tuberculosis. These are the most two effective drugs which are used in TB treatment. But in case of MDR tuberculosis, these two drugs don't work. The second type that we have is pre-extensively drug-resistant TB. We also call it as pre-XDR TB, where X stands for extensive drug resistance. So this is a condition which is worse than MDR tuberculosis because along with isoniazid and rifampin, here the bacteria is resistant to even more type of antibiotics like fluoroquinolones or amikacin, capreomycin, kanamycin. These are all antibiotics which are normally used during tuberculosis. And when a patient has MDR TB, we go for the second line of antibiotics, which is given only when the first line doesn't work. When the first set of drugs don't work, we go for the second set of, second line of antibiotics. So here, even the second line of antibiotics don't work. Okay, so it's worse than MDR. In MDR, at least you have that amikacin, capreomycin or kanamycin as an option because the first line doesn't work, the second line is expected to work. But in pre-extensive drug-resistant TB, even few of these second line drugs may completely fail to work. And then we have the extensively drug-resistant tuberculosis, where in all known antibiotics, whether first line, second line, all known antibiotics which we use for treatment of TB doesn't prove to be effective. And that leaves us with very few options at hand to treat the patient if the patient is suffering from XDR. So this is worse than MDR or pre-XDR. This is the most worst scenario because whatever treatment options are left with us, they are very, very least effective, and at the same time they have a lot of side effects. So you can understand what the problem is. It's a helpless situation wherein we are running out of medication. We don't have options to treat the patient. This is something that is a worse possible scenario because something that was totally curable, now we have a patient losing their life because the known antibiotics are of no use to us. We will discuss more about this part of drug-resistant tuberculosis in the next video. So stay tuned.